Welcome back to the American College of Surgeons Bulletin Brief from the Front Lines, Surgeons' Voices. With me today is Dr. Minerva Romero Arenas. Dr. Arenas is an assistant professor of surgery. She's an endocrine surgeon at the Weill Cornell University School of Medicine in New York. And Dr. Romero Arenas is also one of the founding members of a new society, the Latino Surgical Society. Welcome, Dr. Romero Arenas.
Thank you very much, Dr. Wexner, for the invitation to join you today.
Well, I'm really glad that you're with us today because as we become more and more aggressive on trying to solve the problem of diversity, equity, and inclusion, it's important that we understand what some of those opportunities are to us to help solve the problem and ensure diversity, equity, and inclusion. Some of the societies that represent underrepresented minorities form an important cornerstone of us trying to successfully achieve that mission. Hence, I'd like to hear from you about how your society came to be, perhaps the current composition and size.
Sure. We certainly were established in the spirit of making changes in terms of diversity, equity, and inclusion. There's four of us who founded the organization. We actually were all in various stages of training. Some of us have known each other since we were medical students, and the rest of us met during residency. So Gasser Ortega and Joseph Lopez and I were all residents in the Baltimore area. And Gasser Ortega and I actually have known each other since medical school. Joseph Hernandez More, who is our fourth founder, he and I met during residency. And the four of us came together with an understanding that there were not many other Latino surgeons that we knew or residents that we knew, and really could sort of, on one hand, count the people that we knew across the country. And we thought that it would be really important to create a home for Latino surgeons once we move out of medical school. The truth is that the four of us had been involved with organizations like Latino Medical Student Association. And so we knew that there was tremendous value in having a community of physicians who, peers who share your background, who maybe share some of the unique experiences and challenges. And we wanted to recreate that. We established the organization with the mission to cultivate, nurture, and advance Latino surgeons in the US, and certainly to be a voice for our community and the patients that are represented in the organization. I say that because I think it's important to note that the organization wasn't founded only for Latino surgeons, but for people who believe in creating this space and believe in the mission, and also want to be inclusive and educated in how to best connect with their patients. And those are both things that we think we can provide.
Excellent, a very important mission, and you've been very welcoming to me, and I'm happy to be able to help promote this important effort. I'm in an area of the country where there are many people from all over Latin America, Caribbean, Central America, South America, so very, very aware of the need to promote this type of inclusion and equity. What is the size of the membership pool at the present time?
So our active membership is about 150 members. That currently represents members who are at all levels: students, trainees, and faculty. When we have looked at workforce data for surgeons, we know that in academics, for example, there are just over 400 Latino surgeons at all ranks. And so we really are trying to outreach to everyone, but we would really need to reach every single surgeon to count on a membership, for example, where we could potentially reach 300. And so in addition to that, we don't know the number of surgeons who are not in academics. And those are both some of our key target audiences for membership.
Well, excellent. And so it's important for people to be advocates and allies and to help you find those individuals who aren't in academic practice in particular, wouldn't otherwise necessarily have the opportunity to hear about it. Hopefully, our interview today will help achieve that end to a degree. And certainly, people can go to the website and see it's a very easy application process, and it's a really great way to help ensure that the future keeps getting better and better. As it should. Tell us about any educational activities that the Latino Surgical Society has been conducting.
We've been partnering up at a couple of events. We most consistently have been able to partner with the National Hispanic Medical Association, and we've been able to design now for 2 years in a row. We've been able to design workshops that were in partnership with NHMA and LSS, featuring surgical topics at their national conference. That actually just took place earlier this year in March, and we were able to host 2 workshops. One was a surgical spotlight on Latino healthcare, where we discussed the intersection of surgery in our population in terms of breast cancer, colorectal cancer, and trauma and critical care, as well as lung cancer. So we were able to have that as a CME activity. And in addition to that, we did a second workshop that was aimed at pipeline development, where we had surgeons in several specialties talk about key aspects of deciding for a career in those fields. And we had surgeons participate who were in general surgery, plastic surgery, orthopedics, and urology, and neurosurgery.
And how far down in the ranks are you reaching to tell people about those careers? Is it medical students, is it college students, high school students?
These are 2 of our most recent events, but we really have been holding a variety of events, even providing outreach to pre-medical students. We do have a complimentary membership for pre-medical students to, again, help develop that pipeline at a variety of stages of training. And we offer membership to medical students, residents, and fellows as well.
That's great. That's important to reach down and get people at early stages of their development to become aware and to get excited and energized and want to participate. Another group with whom there might be some interaction are patients, the public at large, and particularly during the COVID-19 pandemic. It's been highlighted that unfortunately there are disparities not just in people getting academic jobs, but in people getting healthcare. And are you doing anything in that front in terms of public awareness on the healthcare disparities, particularly COVID-19, but others as well?
We have actually, during the pandemic, all of our leadership has taken initiatives to provide content on social media, encouraging vaccinations, for example, encouraging at the beginning of the pandemic observation of social distancing and all of the general hygienic precautions that we were recommending. And in addition to that, we've been really working on providing that in multiple languages, primarily in English and Spanish. And in our own, I think, professional spheres, we've been a part of many of those efforts in our own institutions. In terms of the organization itself, again, in addition to helping promote the various educational aspects, we also issued a statement that really addressed the disparity seen related to COVID-19 in the Hispanic Latino community, and a variety of tips that could be followed to help try to mitigate those disparities. And we provided that in the context of a issued statement, but also what we call a visual abstract or an infographic that was available both in English and Spanish.
Great. Some other outreach that you might or might not be doing, but I'm curious with Latin America, with surgeons from Latin America, either using some of the resources of really well-known people to speak at your meetings or to help mentor or to offer opportunities to people who want to. And nobody rotates anywhere anymore during COVID, but in theory, to go spend time with some expert somewhere in Latin America.
Yes, we have done a variety of measures. Certainly our programming was gaining traction when COVID hit, and like everybody else, we had to transition to virtual. One of the things that we actually have found tremendous benefit in is a series of webinars where we have featured well-known surgeons and really successful people who have all been Latino surgeons. One of the things that's been really great about that is that the registration for those webinars is free and it's also open to the world. And so we have actually been able to reach people both in the US and internationally, and we have received really positive feedback. Another aspect of that is with social media campaigning. We took advantage of the Hispanic Heritage Month, for example, and we were able to feature a variety of surgeons. Again, providing that positive role modeling and examples of people who have been able to make careers. That also has been received very positively, and we frequently hear back from not just our members, but people across the world who really find a lot of inspiration in hearing those stories and seeing examples of people like themselves who perhaps give them hope that when they have their dream of coming to practice in the States, that that's also possible.
Great. Where do you envision the society being in, say, 5 to 10 years?
We'd like to have a variety of programming available that is really targeted at each demographic. When I say demographic, we would like to have programming available for pre-medical students, medical students, trainees, and faculty. I think we have recognized that there is an overall underrepresentation of Latino surgeons, but in addition to that, there is a key deficit in leadership. And so we really want to be able to provide programming across all spectrums so that we can mitigate that disparity and help increase the numbers, and the possibility that once we get people in, we can mentor them and help them through the training process, through the faculty tenure and promotions process.
Great, excellent. And how can the rest of us help, people who aren't necessarily Latino surgeons, but want very much to help you be successful in your quest?
That's a great question. I think it starts with being an ally and being in solidarity part of the organization, whether that means becoming a full member or helping amplify the message of the LSS, participating in the various webinars and activities. One of the things that we have tried to do early on is to partner with other organizations so that the impact of our efforts really have been able to reach across and are not just targeting Latino surgeons, but we're also partnering with ACS so that we can reach more surgeons across fields, across the country, across cities. And similarly, we're partnering with other organizations like Association of Women Surgeons, Society of Black Academic Surgeons, recognizing that intersectionality that many of our members have and really trying to connect people with the resources that are going to help them find success.
Yeah, very important. And it is our responsibility, people like me, to support all of those organizations. And raising awareness is certainly only a small part of it. Interviewing you and interviewing people who are active in all of those various societies you mentioned, plus the Society of Asian Academic Surgeons, a variety of groups out there, and intersectionality is an important facet. Any other parting thoughts you'd like to share with us before we conclude?
I want to, on behalf of all the founders, I want to say thank you for the opportunity to share our mission with the audience of the bulletin, and also for everyone can check us out. We're on social media at Latino Surgery, and our website is www.latinosurgicalsociety.org.
Well, thank you once again. Greatly appreciated.
Thank you so much. Have a great day.